Hey, thank you everybody for being here today. Boy, it's been a fun ride of doing these Daniels downloads, and I'm very appreciative of seeing all the names that sign up and the interest level. And for those of you that aren't aware, I do have all of the recordings on a YouTube channel at Daniels Downloads because I've been doing this for a couple years now. But today, for the recording purposes, it's September 26, 2024. This is Daniels Downloads, and kind of calling it building immunity. And as all of you know, you can only do so much in 35 minutes, but I really want to share some highlights that have come to me from being out on the road and visiting with all of you. There's a million ways to go with immunity, but you know the basics. We're going to show some unique components. We're going to start from the top down, but as I always have to say at the beginning, statements made in this presentation are not meant to treat, cure, or diagnose disease. And as people are popping in, I wanted to share this with you. I get Medscape to my phone every day, and I was at an office yesterday, and I said, you will be busy forever with what is out there. And so look at this, like September 23rd, 2024, how the future of medicine will revolve around our gut. Not to be disrespectful to that community, but I think we've all known this for a very, very long time. I've been in this industry for 30 years, and, we were doing gut therapy 30 years ago, from finding the bugs and killing the bugs and leaky gut and probiotics. So be assured that you're in the right place and look at these patients and work with these patients. Then what will keep you also busy forever is this article from September 18th of 2024, Hidden in Plain Sight, the growing epidemic of ultra-processed food addiction. And so we're going to talk about nutrient deficiencies and immunity today. And this is a perfect example of why the Doritos and everything else out there that have zero nutrient component. So I wanted to just show these two, really nothing to do with today's topic per se, but to see what's happening in the medical literature world, what they're talking about, and how that world will keep you, as I said, busy forever. So a refresher on what's going on out there. The greatest threat. The left point here, the study is on the right. The results of the analysis show that a greater number of general symptoms should lead to a diagnosis of influenza or common cold rather than COVID-19. My only point to this is let's not forget about what's always been there. And the idea of today is let's build the system. So the Dorito addiction or whatever it is, we need to build the system to always keep these things at bay. Or, the average is going to get a cold, but what is your duration? Is it weeks or is it a couple days? So here's the graph fact between September and May, cold and flu season spike. We're already, at the end of September. And, that's a reality that's kind of always been there. So there's a need for what we're talking about. You have your tools in your arsenal, but maybe today I might, and I hope I give you a silver bullet or two for potentially new tools that we didn't think of. So today we're going to go about the port of entry. Just 2 months ago in July, we talked about it a little bit. Going to go back there again for a moment. A lot of new faces today. We're going to talk briefly about the GI and immunity, newer little refresher concepts as well, and then foundational immune support, which we'll get into micronutrients a little bit. So here is a real slide in MRI. These are the two eyeballs up here on the left side, and in red, I circled the maxillary sinuses. If you notice on the right side, it's a bigger open area for airflow, but below it is a lot of infection. And on the left side, there's even a very much smaller pocket, and you look at this massive infection. And then a different slice looking down through, well, there's a brain there. It's good to know. On the right side, you have some clarity, but the left side's fully impacted. And the title of the slide is There is a Fungus Among Us. 1994 Mayo Clinic study showed about the effect or the prevalence of fungal infections in the sinuses, such as a case as this, feeding upper respiratory asthmatic issues. Again, I have the luxury of talking to a lot of you and talked to a pulmonologist, and I talked to an ENT from Brazil who is now a licensed naturopath here in Arizona, brilliant young man. He goes, this is very common. This is very common, and we often think of immunity of building the system, but look at the port of entry right here. So I'm a big fan of, have been for 30 years, of doing something to wash it out. I am a huge neti pot fan. Now, it is tough to get into some of these pockets. I hope you all have some kind of a recipe, but I wanted to share with you my recipe, and it's pretty simple. Neti pot solution with your salt solution. If you look up Dr. Hannah, I don't get any kickback from her. I love her neti pot. Nasopure.com, I believe it is, NASOPURE.com. You can buy her salts on Amazon. They're usually for travel packs. I use it every time I travel. But I add liquid iodine forte from Biotics Research at 20 drops. It is 150 micrograms of potassium iodide. It's a clear liquid. Please do not use SSKI. You will cause some serious staining, and it will show up through the skin. Liquid iodine forte is, as I said, a clear liquid, doesn't taste like anything. Low potency. I like around 20 to 30 drops. What is iodine? Antiviral, antibacterial, antifungal. It's a mucolytic, all in one. Now, options, as I put it out here, Bio-8 Emulsion Forte at 8 drops. You're saying, oh my God, that's a ton of vitamin A. You're washing it through, but what are you doing with it? You're increasing secretory IgA in the lining of the tissues. Tea tree oil, as I've mentioned before in my neti pot recipe, 1 drop. 2 drops, you have an out-of-body experience, okay? Very potent. But these funguses, these infections, have not ever seen tea tree oil. And then Larea tincture, creosote. I've used it in the past, and I've used it in, on teeth and gums and things for infection, but I've also used it in the neti pot. Very refreshing, kind of an astringent. So those are your options. You'll all get these slides. I've already made a note on the right here to send you a sheet on iodine, the liquid iodine, in all of its different uses and protocols. So I'll make sure you get that when I send out this recording. So that's what the iodine looks like, clear and liquid, very cost effective. Again, one of those nutrients, a lot of bang for the buck, I always call it. So many areas to apply this safely. And look at here, here's the studies. This came to me, this was from Joe Butchess from one of his Tuesday Minutes. And I've got to give credit where credit is due. Joe's been doing some wonderful Tuesday Minutes. If you don't see those, go to bioticsresearch.com and go to our education department, look up the Tuesday Minutes. He's been doing a lot on this topic. And Arlen Hill, who some of these slides are from as well, Dr. Hill in Texas, he did a webinar. So a longer version of what I'm doing today on immunity. But we're all on the same page. Port of entry, cleaning it up. But look at rapid effective virucidal activity of iodine products against Middle East respiratory syndrome coronavirus. The moral of the story is iodine is super effective, and at low potency, some of you may feel you don't like the high potency. I agree. Low potency, very safe. Again, got to go back here to this product. July, we talked about it, but, I would love for you that are listening in, you have your protocols, but I hope this stimulates you to try some of these new products. As I've been talking about this product, a lot of offices have brought this into their practice, and the subjective response is amazing. Sore throats, gone in a day, things like that. So we did a adult and children's ENT Pro. It's a sublingual, refrigerated, I've got to tell you that so you know it, refrigerated probiotic. You're only doing 1 to 2 per day. Strong adhesion to the mucosal lining. It is focused for here. Ears, nose, throat, right here. This is not a probiotic that we're swallowing per se. Yes, there is some probiotics in there that will head south, but the majority is designed for here, for prevention, for boosting immune response. Here it is. Here's the information. Demonstrate high levels of antagonistic activity towards microbes most frequently found in chronic and reoccurring ENT infections. Look at this, over 40 clinical studies. I don't think I could show you a product in the supplement world with more clinical data that you're taking such a effective therapeutic low dose to get the response. This has been an amazing, amazing product. I hope you all give it a try. Step outside the comfort zone of your protocols. I'm sure they're very effective, but maybe we could just be that much more effective. I bet you know these patients that need this product. And the reason I talk about it like this is because I get excited, as you know, I live, eat, and breathe this world, that we've got to do something better for our patients at times. So statistically, reliable increase in the number of tonsillar cells producing IgA by 30%. That is a massive increase in immunity. So we're talking about immunobiotics with this product. Bacteria that promote health through driving mucosal immune mechanisms. Increased activity of natural cytotoxic tonsillar cells by 3.4 times. This is an effective product at 1 or 2 lozenges a day. And then in there you have the lysosomes. That's why there's adult and a children's version, because the adult version has more lysosome than the children. Lysosome can, if you take a lot of it, potentially loosen up the GI. But it's an enzyme used to, whoops, we really moved forward there. Let's back up. It's an enzyme used to lyse bacterial cells. So very effective immune product. So again, port of entry, we need to support that. So you could do this as a preventatory, because as our kids, as adults, you know, for all of you in the medical practice, seeing a lot of patients, you are exposed on a constant basis. So there's Ozzy in the background giving us a little hello. If you didn't hear that, it's one of the dogs. Virtually all the strains in here are fighting off Candida albicans, Krusei tropicalis at 80 to 100%. So only 1 or 2 lozenges a day. So again, let's back up a second. Let's focus here on the port of entry. But then we also have to focus, where is immunity? It's in the gut, right? I'm going to show you one simple study. I made this slide years ago. And I actually made this, if you're interested, as a point of sale piece, a piece to put on your counter to educate your patients right here. Probiotics and immunity. 326 healthy kids, 3 to 5 years old, 6 months, cold and flu. Look at this. Acidophilus and Acidophilus bifidus, a basic probiotic, 72% less fever, 62% less coughing, 58% less runny noses. Look at this. Overall, here's the statement. Overall, a simple probiotic, 30% fewer days absent from daycare. If you had this sign up on your counter, okay, and you have patients, parents checking out, if they read that, they're going to purchase a quality product from you to help their kids so they're not missing so much school or daycare. So we have to promote immunity in the gut. We could go for 3 hours just on this topic, but we're not going to do that today. And then for all of you that we've talked about ADP for years, but many new faces again, this is kind of the go-to. I have a doctor just down the road. This is his go-to product for anything that shows up immune-wise. What is ADP? Anti-dysbiosis product. But what is it doing? First off, it's an emulsified. So we take an oil of oregano, we emulsify it into small particles, all right? And we put it in a sustained release formula. So it's a small particle emulsified into a tablet, slow release product. What is oregano oil? Antimicrobial, antifungal, antiparasitic. We actually have a parasite study done on this product. It's as effective as some of the prescription antifungals. So as it goes into the GI, yes, we're killing off the bad pathogenic bugs in the GI, but it absorbs systemically very nicely and goes at all the systemic bugs that your patient may be encountering. Look at this. Antiviral activity of Mexican oregano. That's a potent little study right there. This was in, look at this. I'm reading the lines. You don't have to dig into these as much, but all these different viruses that they studied is where oregano oil works so effectively. So if you have a person who isn't responding to your general program, ADP is a rock star. I just was talking to a doctor yesterday. My fault. He didn't know anything about ADP. I can't believe that, but that was my fault. and explained the application. And it's like, man, I need that tool in my toolbox. And then another one that many of us don't think about. I know there's some offices that use a lot of it. I have a doctor in Tucson. This is all she buys from me, is our large 180 tablet bottles of thymus tissue. What is thymus? Non-hormone secreting gland, so it's totally safe for kids and infants. There was a study that showed Biotics Research's thymus was 2 times more active than a competitor. Why? Because they're using adult thymus, which is atrophying as we age. We're using neonatal thymus, which is totally active. Here's the slide. On the left side, look at how nice this tissue looks of neonatal thymus. Very active immune booster. On the right side, adult thymus, lipofuscin, fatty tissue. Not as active, not nearly as healthy. So tissue-specific factors, orally ingested thymic extracts are known to support many aspects of immune function in humans as well as animals. The oral use of thymus tissue, probably the best documented glandular use with over 80 references. Why, again, do I like thymus? Safe for all ages. When my son was in daycare, that was kind of his multi in a way, because I knew what he was being exposed to. We didn't have children's ENT back then. But this is a great one for you out there that are doing chronic immune cases. This is a great chronic immune product. If you're dealing with EBV, CMV, hepatitis C, any of these where you need the body is beat up, there's nothing left. You need that thymus tissue to really help the system get going with an immune response. In those patients, I'd recommend it initially twice a day, so 6 tablets a day. That's why there's the 180 tablet jar. It is a wonderful immune product. It's not one of those where you're gonna go, today, tomorrow, oh my gosh, I'm better. Where kind of ADP and the ENT can kind of do that for you. But thymus is that I need a boost. I've been chronically not well. I need to help my system function better. So we're going to do this in 2 stages a little bit. My next talk in October already, is going to be on more foundational nutrition. We have a lot of foundational multis. And why I share that with you is 1.8 billion is the estimated sales increase between 2023 and 2027 on that foundational nutrition. This is the market. I'm letting you know the numbers of where the market is going, what the patient demand is, the patient interest is we all learn about being ill and learned about zinc and things that were missing in our diet and foundational nutrients that allowed people to get sick. So now money's tighter. They're like, what can I take? We're going to talk about foundational nutrients next month. But foundational immune nutrition, Bioimmunozyme, again, not one I've talked about a lot. I will share with you. It's in my cabinet here. I've known about this product long before I was with Biotics Research. And then immune support packs, a totally convenient pack, wonderful for travel, but all these supportive, and I stress, therapeutic nutrients for immunity. Let's go a little bit deeper. So micronutrients in the immune system. Deficiencies are far more common than we've recognized. Remember, I showed you that first slide from Medscape and the addictive food diet that is devoid of nutrients. That's why these deficiencies are there. Not everybody eats as well as most of you that are watching it. I've always said this, I'm not a purist, but we're really, really good around this house. All right. But as I've always said, I see the line at Starbucks at 3 o'clock for their sugar. I see the line at Chick-fil-A and McDonald's on a regular basis for a lot of people. That's not food. I was telling one of the ladies, doctors listening in here today, just the other day, I was seeing slides. I don't know where I was seeing this, but, McDonald's French fry, 30 years ago, the amount of ingredients versus today. And these foods have dramatically shifted. Gatorade, when it first came out, was 4 or 5 ingredients. Now it's like 25 ingredients. So this is why we're seeing these micronutrient deficiencies. They're massive. So diet alone may not be, or diet alone may be insufficient. We know this. This is, reaching to the choir. I get it. your patient base, let's be real, because I've interviewed some of my wonderful doctors out there. Their patients lie to them, and they tell them how good they eat, but then they're always sick, or they're always inflamed, or they just don't eat well. They just don't. And so that affects acute and chronic immune challenges. So all of what I'm addressing today is both for the acute phase, but for the chronic phase. And I'll show you why, like what you can do dosing wise, like with thymus. Let's back up a second. Thymus, acute, you can hit it really heavy, 9, 12 a day. When they first start feeling, oh my gosh, something's coming on, I want to catch it early. So maybe they do get a little sick, but it's not as long. Okay. But if you have that chronic ill patient, whatever, like we talked about, Epstein-Barr, I always give that as an example, 6-day long-term. I looked at a blood chemistry just the other day. The viral shift, neutrophils, lymphocyte ratio, lymphocytes were lower, the viral shift, low white count, that's a chronic immune case. All right. So I recommended this doctor put this person on, 6 a day of the thymus. Here's the power slide. This is the power slide for all of you to get cozy with. Because sometimes I think we're like uber conservative with our patients. We don't want to, push them away because they're going to go doctor shop somewhere else. But I want you to have the confidence that you will get them well based on telling them this slide right here. For optimal immune protection and resistance to infection, daily intakes may need to be much higher than the RDAs. This is from a 2020 article. So roughly 25 to 75% of people have a dietary intake that is less than the RDA, depending on the micronutrient. The theme of the story all day long from slide 1, we eat like junk. And so we deplete these nutrients or we don't get them in. And so, here's your RDA line. For those listening in, not seeing the slides, you'll get the slides. Marginal subclinical deficiency range, just below the RDA. Like, so the RDA is, let's be real, we're just getting by. We're just like, okay, this is good enough for that person. Don't get me started because I'll get on my soapbox. So I really will. But we need to be above that for these people. So they don't, and I'm not talking massive dosing. I'm not talking that. I'm not that. Some people get to that level. That's not what we're talking. Is we need to give them enough nutrition that they can handle what's coming their way. And we need to give them enough nutrition that they don't have a long illness or a reoccurring illness. So again, above these low standards, please. Be comfortable with that. So immunonutrients, we know about these. Most needed nutrients to sustain immunocompetence. Vitamin A, vitamin D, vitamin E. You notice I didn't talk much about vitamin A and D today because we know this. But look at this. Again, foundational. You're going to hear this from me, I'm sorry, a lot. Sometimes we need to hear it 3, 4, 5 times. And please use that word with your patients. You need foundation in order for me to get you to here. We have all the extras, very specific things if we're working with inflammation or GI, but they need foundational nutrition. So you have, the B vitamins, the vitamin C. Look at this, copper, iron, selenium, zinc. We've all heard about selenium and zinc, but what about copper and iron? Very important in copper, SOD pathways, superoxide dismutase. We have to supply these to these patients. So look at this. There's a rationale for micronutrient supplementation to restore concentrations to recommended levels, especially after an infection. So we take all these products. Oh, the cold's gone, I'm done. Well, you just totally depleted yourself with a cold or a flu or whatever the virus or whatever the bacteria was. You need to replenish and build your system up after that. That is for you, all of you, the what's next for the patient. All right, you've done maybe an IV on them and you put them on a great program and they got better, but it's the what's next for them of, again, foundational nutrition and maybe some specifics from you to rebuild their system. Reported micronutrient intake data suggests that over supplementation is unlikely in most micronutrients, perhaps with the exception of vitamin A in children. Now, as a practitioner, as a doctor, I trust all of you that you watch vitamin A intake, but I will share with you in 30 years, And all of you are happy to text me when things aren't going well or they're going great. I love it all. But in 30 years, I've seen one vitamin A potential toxicity. And this was I was in the clinic setting, and a young girl was using it for her acne. It cleared up so well. She stayed on that high dose for a long time. Okay. So when you're looking across, you've got several supplements on that patient's counter or on your counter, and you're looking, oh my gosh, I'm taking too much stuff. I highly doubt it. Our lifestyles of stress, environment, all these factors, deplete, deplete, deplete. How do we replenish, replenish, replenish? You know, one of my dear mentors, he was in his 90s, still practicing in Tucson. We'd go out for dinner. Yeah, he didn't live the purest lifestyle. He had his Black Russian with our dinner, but that man was more brilliant than most. And I'll tell you what, he said to me, I wouldn't be here at 94 if I wasn't doing these nutrients, because all of his buddies who didn't do these nutrients weren't there. And so we see this time and time again of those stories. So you have a lot to work with here with your patients, because years ago, and I know I presented this up in Santa Fe, New Mexico. I remember this lecture at least 8 to 10 years ago, at least. Alex Vasquez, one of our amazing, amazing, brilliant minds out there, who's done a lot for biotics research, did a wonderful long webinar on immunity and how viruses are the challenge. And I believe that because years earlier, I had really suffered badly with Epstein-Barr. It took me a lot to get out of it. And so I'm a big proponent of you, again, have these opportunities to work with these people to get them to an optimal health place. You have to peel that onion. Doesn't happen overnight. And this is what needs to be communicated with these people. They want that magic pill, get me better, and I'm walking away. But yet they're totally depleted and they don't eat well. So big work for you. I'm sorry, this is a lot of work for you. But could be a lot of fun because it's amazing when people start feeling better. One, how happy they are, but two, all the referrals you will get. Here's Bioimmunozyme. You know, at the time when I came out of college, and I lived in Wisconsin and worked in the clinic there, this was our fall immune multivitamin. We would say, okay, stop your normal multivitamin. Let's add Bioimmunozyme Forte in through the fall season. The kids are back in school. They're meeting these snotty-nosed kids or, you know, immune deficient kids because they eat like junk, you know? And so let's boost their immune system, boost your immune system. This is a wonderful fall immune multivitamin. Again, broad spectrum multi, supports normal, healthy immune function. It has all those microminerals we talked about and glandulars. I'm a huge fan of glandulars. If you're not a fan of glandulars, I would ask you to take the time, take a moment, and let's set up a one-on-one call about it. I would love to hear your perspective, and I would hope you would be open to my perspective, okay? Because I've seen through all these years the effectiveness of good glandular therapy. So it says 2 capsules serving, that's your maintenance dose. But again, coming home from work, oh man, I'm not feeling so hot. Boy, at work, I had a lot of sick people today. I've got to get on something. Boost it up. Go to 2-3 times a day. Go to 3 times a day. Short term. I bet either you beat the curve and don't get sick, or if you do get a little sick, it's not nearly as long. Okay? Here's the label. We're not going to run through it all, but there's your vitamin A that we didn't talk about today. Well, actually, your vitamin C, your E, and there's your B vitamins. You know, there's your zinc at 30 milligrams in 2 capsules. So if you dose it up, you're hitting, remember, above that RDA level, a long shot. I mean, we're already above the daily value at 273% with 30 milligrams of zinc. But sometimes you got to hit it hard. And again, you're not seeing micronutrient excess. There's your selenium. There's adrenal complex and there's thymus in there already. Spleen, liver, pancreas. I mean, a whole barrage of immune protein, and then an herbal of echinacea. This is a wonderful one, and cayenne. And then organic 15. I think I should have a talk, an hour talk on just organic 15. But let me just tell you this. I can't say this, I think, but it is a major methyl donor to promote oxygenation to the cells. Okay? And then the convenient component we talked about was immune support packs. These are a huge hit for offices as well, because the patient comes in, it's often the mom for a lot of my doctors, and it's the husband at home that won't take much, and the wife doesn't want him to get sick. But look at this. Look at these numbers. 75% of Americans report taking dietary supplements. Where are they buying it if they're not buying it from you? Okay. Feel okay about this. Since COVID, 2 and 5, 43% of supplement users changed their supplement routines to focus on immune support. For users aged 18 to 34, 38% of immune support is their #1 request. So we look at immune and foundational nutrition. This is why we're talking about it, because this is where the numbers are at. This is where they're going somewhere else to buy fairly mediocre products, okay?
You say the slides aren't showing. Can you ask how they are?
Is anybody, I've got one person texting saying the slides are not showing. Are you seeing the slides? Can somebody chat to Jacqueline? I will share with you, by the way, segue here. Zoom was having huge issues the past few days. And okay, we got a thumbs up. Okay, great. Because I was on a New York Zoom and they said they've been having issues for days. So what we did is look at this, a 9-in-1 immune formula. 9 of our products, you'll see in the slide here, if you're on the slides, in one packet. It's 5 pills. All these ingredients have therapeutic dose, 1,000 NAC, elderberry, green tea, astragalus, CoQ10, quercetin, 5 caps. So you either take a pack a day as an adult, or if you have kids, divide it up. Give 2 and 3, or 3 and 2, however you want to do that. Or that husband at home that won't take much, but you want him to not get sick, here's your pack a day. It's a 30-day supply. All right. You're going to get the slides on these. We're not going to go through each of these of the dosing. You're going to get 3 slides extra because I want to get to the rest of the presentation because my time is of the essence here. But you'll get exactly what's in it and why. These are 2 great foundational immune products. All right, let's back up. I was going too fast with the slides. So the raffle quiz today, in your chat box, the first 3 to answer in the chat box will get a bottle of Bioimmunozyme Forte, one of my favorites. I don't know why, but I don't think I've ever talked about it. All right, so get in your chat box. Get ready for the question. Taking a probiotic reduced lost daycare time by what percent? A, 15, B, 30, C, 45. Jacqueline's going to write those down and give me those winners for the Bioimmunozyme Forte. And stick around just a second because I want to show you the topic of my next talk because I really appreciate all your interest and time. And I'm always open to ideas, by the way. You could all text me. You have my cell phone number. You have all 3?
Mm-hmm.
All right, she's got the winners. We have our winners as Sarah, Maya, and wow, wonderful, Julia Brits. Wonderful, wonderful. Great winners. Appreciate you all listening in. So October 24th, if you have the time, I know we're all so busy, put it on your calendar. I'll send you out the link to sign up again. But we're going to talk about foundational nutrition equals foundational health. Are your patients fortified? You saw that 2003 to 2027 growth in $1.8 billion in sales of multivitamin projections. All right, because people are looking for that. It's the largest growing consumer market. So did you know that we have 12 different foundation multis? Which one should your patient be on? That's my last little line right there. That's what next month's talk is going to be about. We have so many very cool, very specific multis. Like, did we think about Bioimmunozyme as an immune multi? Maybe not. It's a wonderful immune multi for cold and flu season. Again, here's my phone number, my cell phone number, 602-690-9636. You are all welcome to text me, call me, email me. Let me be a resource for you. I have the luxury of learning from all of you. Again, I've never had an original idea. These are all shared information because I want you all to be the best you can be in your practices. Because sometimes as a clinician, you feel like the only fish in the sea when you're practicing all by yourself. Allow me to help you. So I appreciate your time. I appreciate your interest. I'm going to go to the chat box after Jacqueline stops the recording. And then again, this will all be mailed out to you as a review. Thanks again for hanging out with Daniel's Downloads.